Imagine caring for a patient who's anxious and trusting you completely, and then their care is delayed just because of one missing note. At London Health Sciences Centre, every record we create shapes how care is delivered. Today, our team will share how privacy, confidentiality, and accurate documentation protect patients and the trust they place in us every day. Let's begin. Right patient, right visit, right note. Protecting privacy and care continuity at LHSC. Hello everyone, we're the LHSC Documentation and Privacy Team. I'm Karen.
I'm Yangsun.
I'm Anna.
And Rimpy. Today, we're excited to share how LHSC protects patients' privacy and ensures care continuity through proper documentation and ethical practices.
Ensuring patient safety through accurate documentation. Accurate charting isn't just about data, it's about saving lives. When documentation is clear and complete, clinicians can make faster, safer decisions.
Exactly. Even one small charting error can delay care or cause a misdiagnosis. That is why proper documentation is essential. It keeps patients safe and helps healthcare providers meet professional and legal standards.
It also supports Canada's FIFA law, the Personal Health Information Protection Act, which ensures that patient data is only used and shared appropriately. Privacy and confidentiality, LHS's 5 pillars of clinical documentation. At LHSC, all clinical documentation follows 5 privacy pillars: confidentiality, availability, accountability, integrity, and authenticity.
Confidentiality ensures that only authorized healthcare staff can view patient information. Integrity makes sure every records are accurate, complete, and that corrections are properly recorded. Availability means records are accessible whenever and wherever clinicians need them, which is vital in emergency care.
Next, authenticity verifies that each entry is written and signed by the right person. And finally, accountability is maintained by ensuring every action can be tracked via audit logs and consistent procedural workflows.
Legal frameworks securing clinical documentation. LHSC's documentation practices comply with both federal and provincial privacy law, including FIFA, BIFEDA, PIPA, and QCIPA. Together, these laws protect patient data, promote ethical use of information, and strengthen public trust in healthcare systems.
They also align with global ethics standards from the World Health Organization and the Canadian Institutes of Health Research, which emphasize respect, fairness, and accountability.
Distinguishing quality improvement from research. It's important to understand the difference between quality improvement and research because each has its own privacy and ethics requirements.
QI focuses on improving care within the organization, like reducing charting delays or updating workflow templates.
Research aims to create new, generalizable knowledge and usually requires research ethics board approval and consent, following CIHR and TCP S2 guidelines.
When in doubt, always check with LHSC's Privacy and Ethics Office. They'll guide you on whether your project is QI or research and what protections are needed.
Protect patient privacy. At LHSC, we say document right, document once. It is about doing it right the first time to protect privacy and patient care.
Use secure tools, assess only what you need, log in with your own credentials, co-sign when required, check you are in the right chart, and finalize your notes promptly.
Small actions like these prevent big privacy issues and keep us compliant with FIPA and PIPEDA.
Correct wrong visit notes with confidence. Mistakes happen like entering a note under the wrong visit. At LHSC, we follow a clear 4 steps correction process to fix errors safely while maintaining record integrity.
This ensures quality improvement and prevents accidental data loss, keeping records accurate and trustworthy.
Protecting patient privacy through the identification. When using health data for research, LHSC removes all personal identifiers like names, health card numbers, or addresses. This process, called the identification, protects privacy while allowing important analysis to improve care. It's how LHSC balances innovation with responsibility, following World Health Organization's global ethical guidelines for patient data use.
Final takeaways. So, what's the takeaway? Every note matters because every note represents a patient's life story.
By documenting accurately and ethically, we help ensure patient safety, privacy, and care continuity.
It is also how we build trust. Privacy isn't just a regulation, it is a promise between healthcare professionals and their patients.
Thank you for watching our presentation on protecting privacy and care continuity at LHSC. If you ever have questions about privacy or documentation standards, LHSC's Privacy and Ethics Office is here to help. On behalf of our team, thank you for your dedication to ethical practice and patient protection.
Together, we can keep patient trust at the heart of every record.
At the end of the day, healthcare isn't just about systems or policies. It's about people. Behind every note, there's a patient, a family, and a care team working together to make every moment safe and meaningful. At LHSC, we don't just document. We protect, we uphold trust, and we stand for ethical care.
Because every note matters, and every patient deserves our best.